Right now on 12 on Health, what you can do to improve your quality of life in the face of fierce allergies, plus steps you can take to keep mold from multiplying inside your home, and why doctors say antihistamines work better when taken before your allergic reaction escalates. This is 12 on Health with Gillian Neff.
Hello everyone, welcome to this edition of 12 on Health. Local doctors' offices have been jammed with patients dragged down by allergies, and doctors say the wet weather has sent some people's allergies off the charts.
Definitely the weather makes a big difference on how people feel day to day.
Basically the pollen and the trees and mold and dust mites. I get itchy ears, itchy eyes, rubbing my eyes constantly. Runny nose, and it just never stops. It's all day long, all week long, until the seasons change.
Dreadful. Kerrigan Warnick of Fairfield says treatment is helping her now, but she has spent many a damp day hampered by a proliferation of mold spores in the air. On top of that, this is peak season for tree pollen, and grass pollen is also blowing around. Now to the topic of how to enjoy the summer if you do have allergies. Doctors say when it comes to getting those symptoms under control, part of the job is yours. You need to find out what you're allergic to and avoid it, or at least minimize your exposure to it. How? Close your windows to keep the pollen and mold out. Crank the AC, I love that. Make sure the filters are clean. Use saline to rinse out your nose and eyes regularly. And shower after you spend time outdoors, especially at night before you go to bed. Here with more guidance is Dr. Robert Weiss of the Connecticut Center for Advanced ENT Care. He sees some of the worst cases, and his office is based at the Eye Park in Norwalk. Thanks for being here.
Thank you.
I know you've had surgery all morning. You're a busy man, and I know you see some of the worst cases, people who aren't just muddling through, they can't even go to work, they're so incapacitated.
Right. Your allergies are a bit underrated. People think, oh, it's just allergies, but when you look at some of the studies that have been done, when you look at quality of life indicators, people with allergies actually suffer as much as people with diabetes or hypertension or some of the really big diseases that are out there. So we don't like to minimize the effects of allergies. It really can have an effect on your performance at work, your quality of life. So everything you mentioned is fantastic in terms of avoiding the allergen in the first place and doing things to minimize. But most of the patients we see have done that already. So
They've tried that.
We're up to the next step. Fortunately, there's a lot of good medications out there to help you manage the allergies during the season. And to be a little proactive about it, to take that antihistamine kind of before you need it, or if you know you're in your season, that's the time to start doing it.
There's a pattern, so you want people to recognize the pattern they experience.
Absolutely, it's a predictable thing that's going to be coming. So,
and once they're outside and it's that time of year for them, they know they'll be exposed.
That's correct, and what we're seeing is basically the allergic cascade there. Once the particle, let's say the pollen, gets into your respiratory system, a whole host of things happen in your immune system to react to that particle. And it's really an overreaction, if you will. That's why some people are allergic to trees and grasses and some people aren't. It really depends on your immune system and your prior exposures.
And though that reaction makes just the faucet turn on for congestion.
Right. There's a bunch of things that happen that you secrete more mucus. The mucous membranes swell inside your nose, you get the itchy eyes, the itchy throat. Some people get asthma. So some people can get very sick from their allergies. So again, it's better to be proactive. The good news is there's a lot of good over-the-counter medicine now. Even 10 years ago, we didn't have some of the medicines that we have now that are available over the counter. Between the new antihistamines, the antihistamine eye drops, they're very, very effective.
Oh, tell me about the antihistamine eye drops. Yeah, because I know saline is recommended to clean out your eye, but what do they do? Right,
well, there's one of the biggest complaints people with allergies have is the itchy, irritated eye, or that gritty feeling in your eye. Sometimes you get a filmy look when you go to watch something. So the antihistamine eye drops are very effective at relieving that, and it's only been a few years that they've been available over the counter.
Is there any side effect people need to be careful of? I would be afraid to use them too much.
Yeah, you'd have to obviously consult with your doctor if you have any medical problems. There are a few interactions you might want to be careful with, but basically reading labels and consulting with your doctor.
When it comes to these antihistamines, whether it's Claritin, Benadryl, whatever, you're suggesting they get using it before the allergic reaction even starts?
Right, if you can do that. If you know you're a fall spring allergy person, you pay attention to the pollen counts. You can go online. It's very easy to find out that information. Pay attention to your local allergy, what's going on.
Right, the counts are out there. We give them to you, especially during our weather reports even.
Right, so it's very easy to be proactive and kind of try to stay ahead of the curve, along with obviously avoiding the allergens.
One last question for you because we have a break. Some people think, oh, it may be allergies, it might not be. Year after year you hear them saying that. And I think they're trying to wish them away, and I appreciate that because I sort of fall into that category naturally. But you and other doctors have kind of educated me that they're not going away.
Well, your body does change, as we all know, as we age. So
not for the better.
Some people can actually develop allergies later in life, and some people their allergies actually get better. A lot of it depends on where, if you move, if you're in a different locale. So if you're not sure, you should get tested. See exactly what you're allergic to, and you'll have a better way to manage it if you do that.
That will help you come up with a game plan.
That's it.
Thank you so much, Dr. Weiss. We have a break, but in just a moment, what you can do to keep mold from growing out of control inside your home, especially if your house is prone to flooding. You're watching 12 on Health, your local source for the very latest medical news.